Oh, is that doing it so slow because it's the first time? Oh, there. It is correct. Feed it to Jill. Hello, hello, hello. I am Keisha with Let's Talk Healing. So previously we would come on Wednesdays at noon, and we were doing segments called Keto Coaching with Keisha. But we wanted to kind of rename them because we want to teach more healing. And a lot of times it has nothing to do with what we're eating. So we wanted to rename it. So we're calling it Talking Health. Let's Talk Healing with Keisha. So today we have a very special guest by the name of Faith Gist. Let's welcome Faith. Hi, Faith.
Hi.
And everybody knows Faith. Oh, hold on. I don't know where the feedback is coming from. Okay, we're good now. Sorry about that. Let me make sure that it's still playing. And it is. Okay. We again, let's welcome Faith again. So welcome Faith. I will let Faith introduce herself. I'm going to tell you a little bit first. Faith, of course, everyone knows Faith is one of my very dearest, bestest friends ever. But I'm going to let her tell you about the type of cancer that she dealt with. And we're going to talk to you about some of the things that we learned along her journey, both from her perspective and from my perspective as a friend as well. So Faith,
Yes, Faith, I was diagnosed with invasive ductal carcinoma of the right breast in August of 2019. Let's see. I am triple positive, so my hormone receptors, the ER, PR, and HER2 were all positive. So that kind of made my cancer a little bit more aggressive. It's kind of triple positive and triple negative are both kind of in that more aggressive category. I did have 2 lymph nodes that were positive. They were micromets. It wasn't discovered until my surgery. So.
And tell us what led you to be tested. I know the story, but we'll let you share.
Okay, so the crazy thing is, back in like 2014, I felt something in my breast. And a lot of us probably hear that our breasts are dense or they're very nodular. So it's hard to tell like if you feel a lump or if it's just something else.
Right.
So I felt something. I didn't know what it was. I went to my doctor. I asked him about it. And he was like, oh, I don't think it's anything, but we'll send you to get an ultrasound. I did that. They didn't think it was anything. And for whatever reason, I still question myself why I let it go when I should have kept being persistent like every year. So, of course, they changed the age for screening mammograms to like 40. And so in 2018, I had my first screening mammogram. It was negative. And then it was time for my birthday and time for my second screening mammogram. At the same time, that area in my breast was still there. It was still very noticeable. And for whatever reason, I was having like shooting pains from that area. So it was a constant reminder, you need to schedule your mammogram. And when I scheduled my mammogram, I did a 3D mobile mammography and abnormal findings.
Right. Also, I don't know if you can disclose what you do for a living.
Okay, so irony of it all is I work in the cancer field in a sense. I am an abstractor. So every day I go in and I abstract cancer cases. I actually abstract breast cases, melanoma, pancreas, and some blood cancers. So I'm looking all through patients' records, pulling out information, diagnosis, treatment, and inputting it into a software program.
Right. And I wanted you to say that because for Faith, I knew that she knew before the doctor even told her, and I would beg her, and she could tell, I was like, Faith, please don't read the charts. And I knew I was just talking to the wall, like, Faith, just don't read it. Don't read it. Let's just wait and see what the doctor says. And of course she didn't. And so I'm pretty sure, well, I know that you read it first before the doctors ever told you you knew.
Yes, I did. I remember getting the mammogram, and then at the same time, I was dealing with after effects from a car accident. So I was sitting in the lobby of the physical therapy office when I got the notification, my chart, that my mammogram had came through. And I remember when I went back for the second like mammogram or ultrasound, the tech told me that, oh, well, we have to use certain words to make sure that insurance covers the cost of your mammogram. And I was like, yeah, I get that. But those same words that you use are also like trigger words for us of what we say, okay, we need to document this in the patient's abstract.
So of course they knew before they even told her. What do you think the hardest thing was when you first got the diagnosis? What do you think the hardest was?
I think it would have to be slowing down and taking my time to process it and to figure out what's the best step. Because immediately your mind kind of goes into the fight or flight mode, and you really start like, okay, I need to get this out of me. And then you just start thinking about the processes, the different treatments, and how all that's going to look, how all of that's going to affect my life, my family, my friends. So I think that was probably the biggest thing.
Right. How did your family take the news? And I don't even know if I've ever asked that. I think I did.
Sometimes it all seems like a blur. I was selective, I think, as far as who I shared it with. Mm-hmm. And it wasn't on purpose in the beginning. When I did, I felt like I was protecting them. So even in sharing it like with my husband, like I was trying to ease it in like slowly because I was trying to protect how he would respond to it. And I think Dallas was probably the same way. I tried to I was more being protective instead of allowing them to really comfort and support me. And so then when I
Right.
did start telling more family, I just noticed like I was doing that. Like I was having to comfort them and their emotions and how they were feeling instead of them comforting me. So it kind of
Right.
made me kind of back off sharing
Right.
it so much.
I can actually remember when that happened. And it was a great learning experience for me when it came to learning how other people deal with traumas that they have. Because watching you deal with that, I saw firsthand that then you not only deal with your grief, you deal with your grief and the grief of the others of the people you just told.
Mm-hmm.
Because of course, anytime we get that diagnosis, then the diagnosis in itself is just so overwhelming. And when we tell others, I'm having a hard time, you're having a hard time processing it yourself, but now I have to process how I interpret it or how you interpret it, as well as how everybody else is dealing with it.
Mm-hmm.
And I just happen to know that Faith is a nurturer and an empath by nature. So that just became too overwhelming, way too overwhelming. And it was like, wait a minute. So what we did for our friend group, I communicated to them initially. So I would communicate to them what was going on. That meant that she didn't have to tell each one of them separately and continue to relive that and rehash that over and over and over again. Because remember, every time she does it, that's another hurt she has to deal with,
Mm-hmm.
including her own. Right, which is hard. And that's the part that a lot of people don't get. And I didn't get until I saw Faith deal with it. And so that's what I did until she created the Karen Bridge page. And once she did that, she was able to communicate with once and send everybody updates with what was going on. So I'm saying that to say, if people don't tell you, don't feel offended. It could be them protecting you. And it could be too much, so much that they're dealing with and trying to, process themselves that they can't process themselves dealing with it and you dealing with it too. So sometimes we have to learn to take ourselves out of the situation. And in that instance, that's what we had to do. And so as her friends, what we had to do was say, so how do we help this chick who won't ever tell us what she needs? Because she will not.
No.
So how do you help the person who will never tell you or who will never say, help me? So what would your suggestion be to those people who are like you, who don't easily or never ask for help, even when like the tip of my fingers are up in the air because everything else is underwater and I'm just overwhelmed with life in general, on top of all this other stuff that I have going on with the cancer diagnosis? So what would your suggestion be to those people when they have that going on?
I'm still figuring that out.
Right.
It is kind of like a trial and error, but with us reading that book, The Cancer Whisperer, it really was eye-opening in how to ask for help. So I learned a lot from her story and her journey. Make a list. I mean, that's really kind of I want to say the easier thing to do is to if you can't verbally say it, because sometimes it's hard to verbalize versus writing,
Right.
write it down, and create a list of things that you may need help with, or share how you're feeling, especially like after you go through your first treatment, or it could be after you've had surgery and you're not able to get around as much. Write down a list of all of the things that you normally do and how that's been affected. Then share that with your person, which you were my person, and let them share it with the rest of your village, I say. Because then that way the pressure is off of me. And for me, it was almost like you just have to do it. You know that saying where they say do and then ask for forgiveness later? Like that's just kind of how it is with me, because I had you guys asking, like, you want us to help come clean the house? No, you can't come see this what? No. So it was like you just have to do it.
Right.
Because I'm that person, like I struggle with asking for help. So I would say make a list of everything that you possibly need, or think about, like meals, that kind of thing, and write it down and then share it. And then kind of release yourself from it.
And as a friend to people who are like us, because I'm like that too. Right. What you have to do is you have to kind of listen and really listen, because and listen and let them vent, because in their venting, hear the need, because they're not asking, and they don't, and they won't ask you for help. And even then they aren't asking for help. But in the venting, if you hear the need, as a friend, you just do it.
Yeah.
So ask
That's
Faith.
true.
That's what we would do, and be like, Faith, we'll be at your house at such and such time and date, and we're coming to do this. No, you're not. Yes, we are. Yes, we are. This is your village. This is what we are for. It isn't for anybody else to know. This is the first time we've ever repeated it for anybody else to know outside of us. But this is so others can know. This is what you do. This is how you be a friend. Because it isn't for everybody else to know. It is you hear the need. And even if they don't ask for help, you're listening at them vent. And again, they're not venting to ask for help. They're just venting. And so you just listen for the need. And then you do what you can to make it work better for them. And sometimes that means doing things when they don't like, or doing things that they're not comfortable with. Not saying she don't like, because I'm pretty sure she was pleased, but they're not comfortable. She's not comfortable asking for help, which is hard when you need it.
Yeah.
Hard when you need it.
Definitely.
So tell us about your treatments. So what was your treatment plan?
Okay, so I had actually, my initial biopsy was in situ. So that means that it was like the least like superficial type of cancer. However, on imaging, they couldn't tell if there was an actual mass or if it was just like these clusters. So I did another biopsy, and that one was in a different area of my breast. It was more so like near the nipple. And that one also came back. It was in situ. But the initial biopsy, once the final path was read, it came back like 0.1 of invasive carcinoma. So because I had two areas of concern, it kind of opened the window from a lumpectomy to a mastectomy. Right. I could have chosen to have a lumpectomy in both areas, but I'm kind of extra. And I was extreme, and I was like, take it off. I don't need it. I'm done.
Yeah.
It served its purpose.
Anymore.
Right. So I opted for a mastectomy. And just to say, there's no real like scientific um, data that says a mastectomy decreases your chances of recurrence over a lumpectomy. But for my personal mental health, I just wanted it gone. So I chose to have a right breast mastectomy, and they removed two of my lymph nodes. And I will say my initial during surgery path for my lymph nodes were negative. So we were all excited, yay. And then the finding came back that it was micro mets. So it was like less than 0.2 centimeters. And if they had known that during surgery, they would have taken out more lymph nodes just to make sure. So after surgery, I proceeded with chemotherapy. I had 6 cycles of it's a regimen called TCHB. So it's like Taxotere, carboplatin, and then immunotherapy, two different ones. But of course, my body is very, very finicky. And they did like immediate reconstruction. So that consisted of like this plastic, kind of looked like a half of a football put inside. And every week I would go to the plastic surgeon and they would insert fluid in it, IV fluid, to make it bigger. So it's supposed to like stretch your skin so you can be ready for an implant. My body did not like that thing. So like a month
Not at all.
after, a month after surgery, I started chemo, and chemo really wrecks your body. It's completely stops your healing process. And my wound started to open up. So over the course from September to February, I ended up having 3 more surgeries, revisions to cut off like the tissue that wasn't healing and sew it all back up and then start the process over. So it would stretch out my chemo even longer. So what was supposed to take like 12 weeks, I started chemo in October. I didn't finish chemo until April because it just stretched it out so far. After chemo, I continued with my immunotherapy. I did radiation, which was a whole nother beast. And then after radiation, I started on hormone therapy, and I finished immunotherapy like that November.
And then, so Faith started, that was October of 2019.
Mm-hmm.
Right. And then COVID comes along before she finishes,
Yes.
which is a whole different ball game. So now you have dealing with the effects of breast cancer, dealing with treatments, dealing with a weakened immune system because you're doing chemotherapy during the time of COVID.
Mm-hmm.
So how was that actually?
That's been a really traumatic piece for me, because you're already going through something that's just stripping your body. And now you have to protect yourself from something. And so honestly, my biggest fear is like, I like getting COVID. And there, before we knew what COVID was and testing and everything, I mean, it's a possibility that I had it, because I remember Dallas getting sick, and then of course Dallas gets sick, I get sick, and it put me down. And it was scary. So just adding that to the mix, like it just increased my fears. It's already you're thinking about cancer and what could happen with that. And then you have the treatment and what could happen from that. And now you have COVID. On top of the fact that going for treatment, you're sitting in this big old room everybody's in recliners, everybody has on their mask, you're alone.
Right. Now you're alone.
It felt good to be able to drive myself and come home. Like, that part made me feel like I was a little bit more in control, but at the same time, it was it was lonely because you didn't have,
Right.
like, you were there, like, talking like the whole time. So in the
Right.
beginning, so you don't even know, like, treatment is done. So
Right.
when they took away that part.
So right, when Faye first started her treatments, I was able to go with her. And we would sit there because I would just take the laptop and we would talk all day. But of course, once COVID came along, that was a no-go.
Right.
She had to go by herself. So that was a whole different thing then. Tell us, what do you think, how did Dallas do with a lot of that? Now, I know he probably had no problems with Samantha helping out and picking him up. Samantha is my 21-year-old daughter, which he adores.
Yeah.
Of course, has long legs and gorgeous. So, of course, he has no issues with Sam picking him up. But so how do you think that the adjustment was for him? Because that was his adjustment during COVID too, was a lot different than a lot of the others, because you were dealing with the effects of treatment along with a pandemic.
So Dallas has already been through other traumatic events in our family, and
Right.
like we still deal with that, and trying to help him, like, express emotion and feel like he's in a safe place where he can talk and share that. So I don't know if he really fully understood, like, everything that I was going through.
Right.
For him, it was like surface. So me shaving my hair, why did you shave your hair? I don't like that. I don't. But then he wanted to do it. And
he did want to do it.
Yeah, and I thought that was sweet, but then it was like, okay, well, do you understand why you want to do it, or you just want to do it because mommy did it? So I didn't, like, push it as far as him, like, but I thought it was cute that he wanted to do it. But like, he would tell me, I don't like your hair like that. When is your hair gonna grow back? Why did you, cut your hair? And he would even tell me, he's like, I hate cancer. Like, why did it happen? And you trying to figure out how to explain it.
Right.
At the same time, we try to keep things as normal as possible. Mm-hmm. And so, me being very hands-on, that was hard, having to just be in the bed and let, dad take over and do his thing. And which, I mean, dad already was, they go and do and play and whatever. So it just, like, had to increase, But then because of COVID, it really, with the whole e-learning, even when they said, okay, we can go back to school, I was hesitant because I'm like, Dallas go to school, he gets sick, I'm gonna get sick. And that's being healthy. So add chemo, weaken the immune system, I had to keep him home.
Right.
And that wasn't very beneficial for his social development, which is something that we already have to work on. But it's the side effect.
But that was one thing that I was having a conversation over the weekend, even with adults who aren't dealing with traumas from, just being withdrawn from, socially during the pandemic, is something we're just going to have to figure out how to recover from. How do we recover from that?
Right. I'm still figuring that out, because it seems like every time you kind of feel like, okay, I can let the guard down. Then it's
Right,
like people in your circle around you get COVID, and it's like, oh my God.
right. I finally let my guard down. What happened? I got COVID.
And see, and I have graduation Friday. So
Right.
in my mind, I'm freaking out because we're going to be in this big old building with all these thousands of people, but I'm going to wear my mask until it's time to walk across the
Right.
stage. And hopefully you don't,
Exactly.
that's just like, it's like, do I really want to do this? Like,
Mm.
that's just kind of that fear that, you try to not live in fear, but at the same time, it is there.
It is there. And it's something that we do have to think about. And so faith has been very, if so, anytime that I knew if I was having to do something for faith, I wasn't going outside the house. I didn't leave, like, because I was like, I can't like risk catching COVID and giving it to her, because I would just like freak out. So if she had to have something done, or if I knew I needed to do something for her, then I made sure I protected myself so I wouldn't pass it on to her. So, and I'm saying that if you're a support person and a friend, those are things that you have to think about. You just can't just be just doing stuff and saying, oh, why I'll be okay. No, it don't work like that. No. So I laughed and told everybody I went outside one weekend. I can't go back out anymore. Went outside one weekend, caught COVID, and was in since then.
Talking about that made me
Go
think
ahead.
about January when I had my reconstruction. Literally driving to Charleston and gets a phone
Right.
call that I tested positive for COVID.
Right.
I immediately like broke down. It was like, wait, Keisha's in the car at me. She's gonna get sick. Like I just lost it.
She
I think,
did. Um,
yeah.
she
Where did
freaked
I end
out.
up
I was
pulling up?
like, pull over anywhere. We pulled over in some pasture thing.
It was at the fairgrounds. I passed the cemetery. I was about to park in the cemetery. I was like, no, I can't park in the cemetery. Something's not right with it. But yeah, I was no good after that. And I didn't
Right. And
understand
her
because
thing was she thought her doctor had called and said we were on the way to Charleston for her to do some stuff for her reconstruction surgery. And this was one of the times I had been inside, so I wouldn't catch COVID because I knew I had to go down there with her. And the doctor calls and told her test came back positive. She's freaking out because I'm in the car with her thinking that, well, she's made me sick. And I'm like, well, I'm fine. Only reason I've been in the house, so I don't get you sick. But she is freaking out. I'm like, just pull over, please. Let me drive.
yes,
We okay. We'll
I was
go
no
back
good.
home and this is going to be okay.
Yeah. And I ended up,
Ended
how
up,
many did I get? Like 3 more tests after that?
after that, and
Yeah.
we both were fine. We both ended up being in quarantine, and we both were fine. I ended up going around somebody else because I just knew I was positive anyway, because I thought I had some faith. And we both came out positive in the end. So that wasn't it. And we were good. What are some of the things that, let me say this first. Well, some of the things that when you were going through things, I would ask, they don't have any resources for this? Like when you were dealing with losing your hair. Of course, I could be there as a friend, but I thought it would help if you could rely and talk to other people who had gone through it. And so a lot of things I kept asking, do they have like this for you? And the answer was always no. I'd be like, do they have like people you can talk to for that? No. What would be some of the things that you would suggest? I know we ended up going to some cancer classes together here in Columbia, and they helped. They helped you. They helped me understand. It helped me implement some changes, even in my house for prevention. So what would be some things that you would suggest people do to help if they're going through it, to ease it? Because I know, even when we know people who are going through it, I always ask Faith, do you mind if I pass your name on to such and such, so you could talk to them? Because I knew what it was like, because you didn't have anybody to talk to. Again, as friends, we can help and we can be support people and we can be friends, but it is different when you can talk to someone who's been through what you're going through. So what would be some suggestions you would give to someone who's newly diagnosed or who's currently going through treatments?
So there are certain programs that exist depending on where you live, where you're going to get treatment from. The dynamic of it all varies. So, I went to Jacksonville for a second opinion. And if I lived closer, I probably would have done everything there, because it's very patient oriented and they are really trying to help the whole patient. So they're offering yoga and meditation and acupuncture, and they connect you with someone who sells wigs and all those things. And it's like, wow. Some of that was offered here. Like, I know about the wig stuff. They had some classes, they offered some classes like on how to do head wraps, how to wear scarves. I did take a class that was offered through, I think it was a national organization that showed you how to apply makeup. And so I think the first thing as an individual, you have to kind of take an inventory on what's important to you and what you feel like you need to feel like you. And because I hadn't shared it with everybody, I didn't want someone to look at me and be like, oh, like she's like, yeah, something's not right. I didn't. Even though I will say some of them wigs I was wearing, somebody had some questions, because I look back at the wigs and I'm like, that wasn't right. But take inventory on what's important for you. Like, I will say, I kind of freaked out. Like, I went out and I bought all kind of makeup. I went out and I bought lashes, because what if my lashes fall out? You're gonna be able to tell. I was trying to figure out how to draw eyebrows on.
I remember that one.
Yeah, and even with taking the free class on the makeup, I ended up booking a private session with a makeup artist and went through that, hands on. Like, she did one side, I did the other side. But it's taking inventory on what you need to like feel normal. There are some local like organizations, like, even if the information isn't provided for you, ask the questions.
Right.
I think a lot of times locally, it's kind of become like such a routine, and those things aren't used and utilized. So even if like they'll share it with you, but you kind of have to get out of your comfort zone and explore it and use it, because there's a lot of stuff that's out there that you don't use because your mind is just not really focused on that. But at some point it might change for you to where, okay, for the longest time, I didn't have like a mastectomy like bra, you know. I had like it looked like cotton and I would just like stuff it and put it and I didn't care. And then at some point it was like they're not they're not the same. And so, going to the place and getting the mastectomy bra with the prosthesis, like that was a game changer for me. I felt like a brand new person. So you kind of have to take inventory on what it is that you need to feel like whole. Um, not so much focus like, people might think like, oh, on the physical, like that's nothing. But if that's what helps you wake up in the morning and find your purpose, putting on eyebrows and lashes or a wig or a head wrap, do it.
Do that. Right.
Yeah.
Um, you know, and as friends, one of the things you have to not do what you think is best, but and you really have to use listening skills and hear and take yourself out of the situation, and do what you think is best for the friend. You know what I'm saying?
Yeah.
And that has to be very important. Um, you know, because when you were going through those things, sometimes it was, I have to, let me rearrange my schedule to see what's going, because y'all don't understand. Faith is so private. Like, let me lean in a little bit closer. She is so, so, so private and
Some people know that.
will not ask for help from anyone. So if she asked me at all for help, that means I needed to do the very best that I could do to make sure that I carried it out. And when she first had her reconstruction surgery and she went to Charleston this year, I thought I had COVID. So I wasn't able to go. But then when she came back, again, but I always thank God that my schedule is set a way that I can rearrange and I can work from anywhere. But again, as friends, you have to make sure that you listen and you see what the need is. Because they won't always say, hey, I need this. You're not going to say, hey, I need some help cleaning the house. She might say, laundry ain't been done, and such and such and such and such. And in the background, you writing it down and you hear the need. And you have to call and say, hey, I'm coming.
In 30 minutes.
This is what it is. Right. Don't give time,
time
for her to back out, because they will.
So, and don't get up and try to clean.
Don't do anything. And that's what friends are supposed to do. That's what your support people are supposed to do. And you're never supposed to hear about it again. You don't. Again, Faith knows this is the first time we've ever talked about it amongst anybody else except for us. But again, that's so other people can know. That's what you're supposed to do. You have to learn to listen, and hear the need when they're venting, because they're not going to come out and say, hey, I need this. When they're venting, you have to listen for the need then. And I'll have to admit, because I know Faith, I know my friend, and this is the first time she's heard this, I have to admit I was very hesitant, because I also didn't want to take away her safe space to vent again. You know what I'm saying? Because in doing that, I wanted her to be okay with us helping. But I also want her to know that I don't want her to think the next time she vents again, we're going to come with the cavalry. Because we might. We just might. Depends on the situation. Right. But again, you just have to listen and make sure you're listening to help with a listening ear to help. What about, we have a few more minutes. So what about, and as a friend, a single friend, and I always say, don't ask me because I'm the one who's single. And Faith will tell you, I'll put in my 2 cents worth, and then I always go in and don't ask me because I sleep by myself every night. So don't ask me. But anyway, what has this been like for your marriage?
Oh my gosh. You know, we're a different pair because we've been through so much other stuff
Right.
that it just felt like here's something else. So it's like role reversal. I've gone through the phases where I had to take care of him, when he tore his Achilles, well, both of them. So, it's just like a role reversal. And it's been tough because I mean in general, I'm I've always been independent. So it's taken a lot just in the course of our relationship and then getting married, of letting those walls down and letting him,
Right.
lead and do his thing. And that it just in general has been kind of hard. And then you add this and you just feel completely helpless, you know. It adds another layer of hardness to it, because and then being in support groups
Right.
don't help, because it helps but it doesn't help because you see the good and the bad. So you're like conscious of you know the experiences that other people are having, the difficulties
Right.
that they're having. So it was like, wait, we still have to like try to communicate. We have to try to find time for each other, be creative with things that we do, which we already struggle with those things because we're older parents, and so we don't have those babysitters and stuff. So we would have to like be creative with how we spend time with each other. But it's hard. It's really hard, and I've seen how it has really stretched him in a sense, just emotionally. I guess the thought of me having cancer and losing me or something like that, like all of those thoughts, like even if he doesn't talk about it, it's there. You see it.
Right. Yeah, thank you.
Yeah, and he
Right.
goes into like straight protective mode. So then you have to like calm down, like relax,
Right.
But yeah,
Right.
it's been a journey. It's definitely been a journey.
Right. That's something that everybody around the people who are going through things have to learn, because there are so many emotions, like, and everybody has their own, and so everybody is trying to cope, and it's one of the things that most people don't know how to do, honestly.
Right. Yeah.
We don't know how to cope, and so you have all these different emotions that you're going through. What I found myself doing was, and this first time Faith is here, and so y'all, this first time she ever know, was like doing the heart of that when I know you were going through it the most, like especially this year when you were having such a hard time after Reconstruction, was praying daily for your marriage. Like, yeah, Faith never know I did that. Because no, because it was what my friend needed. Because at the end of the day, Mickey loves Faith and Faith loves Mickey. And I never want to see, and that's hard because when you're going through these things, it is hard. And also Faith has, she takes care of her mom with dementia.
Yes.
Whew.
Yes. She's been here
It's
for
hard.
3.5 years.
Right.
So that's before
Right.
the cancer, during the cancer, after the cancer, and then Reconstruction. Like it, yeah, that adds a whole new layer.
A whole bunch of brick layers.
Yeah.
And that. So, you have to learn, like I had to learn to God move, like God moving this, because I know you're the only person who can, because it's just a lot. It was a lot for you to deal with. And in order to make me easier with everything you're going through was for God to make your burdens easier. So in order to fix that, I had to learn, instead of praying for me in the situation, I had to pray for you. That was a lesson. That was a lesson I had to learn. And often, we don't understand that. We don't know how to do that because we're so caught up in everything, because we just have so much going on in the world. Like seriously, with work and everything, you had COVID, you had cancer, you had all these different things. And so often we don't know how to process everything. So in hearing, in listening, you learn, and I learned to pray in order to make me easy with things. Give my friend what she needs, God. That was my prayer. That makes everything works better. And after a while, all the situations just started to work better. Again, as friends, our times run out. As friends, I'll say my part and then I'll let Faith in. As friends, you have to listen. You have to listen, and you have to learn to take yourself out of it, because as friends, we can get so caught up. We can get very caught up. And I'm the bully friend. I'm the friend I'm the bully friend. Because if you come for my friend, I'm coming for you. That's the friend. I'm that friend. So Faith is the meek and mild friend. But I'm that friend. So, you have to learn how to not do that, and how to take yourself out of it, and how to listen, how to listen for what's best for them, how to listen for the need. And again, in their venting, see where you can help, because they're not always going to ask for help. They're not going to ask for help. So you have to see where the need is. And sometimes I don't know, maybe that's the balance, because I can be the assertive friend and say, well, Faith, look, you need to go to the doctor and I'm on my way. I suggest you have some clothes on. That's all I'm going to say.
Yeah, she
right.
did.
And that's all I'm going to say. I'm on my way. My suggestion is you have some clothes on. That's it. I'll be there in 10 minutes. But I'm that friend. Again, so, the balance, there's a balance in there. Learn everything you need to learn, because when Faith was going through it, it wasn't just her. What we as her friend group, not just me, her whole, all of us, what we said to her was, this is our journey, not just yours. This is our journey. God chose you for a reason, but it's our journey. And we're going to make sure we go through this with you. And at the end of the day, Faith knows she can call on either one of us any time of the day, and we're gonna drop whatever, and we'll be there. Make sure you know who those friends are. And if you're that friend, then make sure whatever it is, then you can do what that is. Even if it's just to listen. Even if it's just to listen. And let them know they aren't alone. Like we kept reassuring her. You're not by yourself. This is our journey. God chose you to go through it, but it's our journey. And in the end, we're going to rejoice in this testimony with you. We're going to rejoice in this testimony with you. So make sure, that you listen. Make sure that you get educated. Again, make sure you get educated. When Faith read the book, I read the book. I read the book.
Yes.
Right. Because I needed to understand. Now, again, my job is one that thank God I was able to do that. But but I needed to understand, what she was going through. And in order for me to understand that, we read the book together. So, and I was zooming through reading it too. So I'll let Faith in, and then I'll come back with closing.
Yeah, I mean, I'm coming up on 2 years next month. And
Wow.
even in those 2 years, it doesn't feel like it's been 2 years. It feels like it was, just yesterday.
Right.
And it's not over. Like,
Right.
unfortunately, you just don't, even with, cancer removed, even with waiting to do reconstruction, like that fear, that thought, that worry,
Right.
it's still there. It's a continuous journey. It's a journey that I'm going to be on for the rest of my life, And so I'm continuing to try to evolve and open up more and be, more open with sharing about what I've gone through, try to be a listening ear for others who may be going through this journey. And just trying to help people figure out, what's best for them in this journey, in this process, for you individually, and then for those around you, so that, your village can help you as much as possible.
Right.
So yeah, it's keep going.
Okay. Well, Faith, we thank you. We'll ask you to come back again in maybe a couple of months. They probably have a couple of people on, to give some maybe we can do some detailed discussions on some things. I know we talked in detail about how our community is just not at liberty to access to a lot of different resources.
Mm-hmm.
So maybe we can come back in a couple of months and discuss that. Maybe we can get couple other people to join in. That would be great.
That would be.
Yeah. Now, of course, thank you. I kind of sprung it on her. I was like, Faith, you remember you said you was going to do that with me. How about I do it in 2 weeks? Okay. So again, we thank you, appreciate you. I always love you, do whatever I can to help. And for you guys who are joining in, we thank you. And if you have not subscribed to my YouTube channel, please make sure you hit that subscribe button and subscribe. Next week, we have our special guest coming, and I will be posting her information later today. We're going to talk an in-depth conversation about carnivore on next week. So, and then following that, we have a strength trainer coming and talking about how good weightlifting is for your muscles. So have a few things lined up. So again, thank you, Faith. You guys, we love you, and we will see you on next week with Let's Talk Healing with Keisha. Have a good one.